welcome everybody. Thank you for joining our session. It is 3 o'clock, so we will begin. Just a quick note regarding the session, we'll have some more folks likely trickle in here. Please be aware that the session is being recorded and that we won't be editing out any identifying information. If you have any questions, feel free, you can put it in the chat or in the Q&A box. Right now, I just want to also just note that I have two people from the project team here, Adam Fox and Adela Flores-Brennan, and just want to let you guys know that I will be presenting, but they'll be here to also support any questions that you guys might have regarding the project. So without further ado, we'll begin. So again, welcome. Our session title is BeHeard Colorado, Advocacy and Leadership Project. I'm Eric Moore. And just want to give an opportunity for my other two co-partners to actually introduce themselves here.
Hi, everyone. I'm Adela Flores-Brennan. I'm the executive director of an organization called the Colorado Consumer Health Initiative.
Hi, everybody. My name is Adam Fox, and I'm the deputy director at CCHI with Adela.
Thank you, Adela and Adam. Again, I'm Eric Moore. I work at the Center for African American Health. I am the policy and research manager, and I'm one half of the community engagement research team. So just some technical housekeeping regarding this webinar. You'll see at the bottom, there's a chat box in the Zoom screen here. If you have any technical issues, go ahead and click on the box that says all panelists, and you can let us know what might be some issues and we can help resolve that for you. If you have any questions or you want to interact with panelists and other attendees in the session, you can go ahead and actually click all panelists and attendees, and everybody will see your message. You can also you can keep in mind that we can't see your faces, so feel free to use that chat in the Q&A box to let us know what you're thinking or if you have any questions at all. So what I like to do here is I'm going to actually get a PowerPoint set up so that we can walk through this presentation. And just want to say, please note that this presentation is actually one that we've presented back in October and November of last year, 2020. And it was for a much longer web session. We only had 30 minutes here today. So this is going to be more of an abbreviated overview of that presentation. And then I also noticed that there's some information that I'll have to update as we talk because I don't have updated slides. So as we get to those points, we'll go ahead and verbalize that so you guys know what's the most current information around the project. So you guys should be able to see my screen now. I'm going to go ahead and cycle through here, make sure that we are good. All right, here we are. Okay, so who is BeHeard Colorado? So just a simple line would be is BeHeard Colorado is main goal is to support community leaders to be heard and advance equity and health policy. So more specifically, what BeHeard is a partnership between the Center for African American Health and the Colorado Consumer Health Initiative. And not only is it a partnership between our two organizations, it's also a partnership with African American and Black community members, where we want to make sure that we have the opportunity to bring community members into the forefront of the health equity policy space, and that everything when it comes to the issues that community is dealing with, all the way to the solutions that they think is best to address the issues they have, are led by them. Some context, BeHeard Colorado is is more of an extension off of BeHeard Mile High, which is a project from the Center for African American Health that we started back in 2016. And it's a it's a data advocacy platform that allows us to digitally connect with community members using surveys on understanding what the issues are and some of the solutions that community members would like to see be done to resolve a lot of the issues around health and social justice. So with BeHeard Colorado, it's an opportunity to engage and learn with community members. And we'll talk a little bit more, but also other people outside of the community, looking at different entities that work for community, such as community-based organizations like health clinics, nonprofits, even business entities, faith-based organizations, and of course, working with decision makers and policy makers from community level all the way to the state capitol. And it's really an opportunity for us to make sure that we can have community champion the issues that they want to see done, and it's done through these partnerships that we're able to do that. And ultimately, it's to help with creating health policy change that actually creates equity for the community. So one thing we'll say, and we'll go briefly because it is shorter. One thing I would love for you guys to do is in the chat to just tell us your name and where you live. And if you had a magic wand, what healthcare problem would you solve? And if you like, you can tell us why. I'll just say, and feel free, you guys can put this in the chat as I go through the rest of the presentation here. So again, I'm Eric Moore. I live in Aurora, Colorado. Specifically, I live in Aurora Highlands neighborhood, which is right off of iLift and Chambers. And if I had a magic wand to solve a healthcare problem, it would be specifically to deal with all healthcare disparities across all communities. I think in particular, when we talk about equality, that's something that we have to consider is not that it's specifically for any one group or ideology or identity, but for all human beings as something that we should all be able to actually experience on this planet. So feel free in the chat, go ahead and tell us what healthcare problem you would solve and why. So why are we focusing on health policy and health equity? Well, specifically, when it comes to African American and Black Americans, we have for decades we've had data and experiences, stories told by community members around the differences around health outcomes and some of the experiences we get while working through healthcare systems. So this is really an opportunity for us to be able to make sure that we're addressing some of those things that we've known for a while, but doing it in a smarter way around using data and using storytelling directly from community members. Health equity, again, is for us to make sure that we're addressing a lot of those things and also considering a lot of the social and economic considerations when it comes to how our health outcomes are guided. So when we look at social conditions, we think about things like our income, education, where we live, and where we live is important in particular to where we have access to physical healthcare systems, such as clinics and hospitals. Oftentimes, these systems are not able to address our needs, and when it comes to policy and systemic changes, they can be slow to respond because of the landscape around policy, some of the leadership around the information they have around the community for the communities that they serve. And this project is aiming to work on making sure that community is able to have more of an influence in this space of influence and policy that impacts our health. Something else is also, I did mention that we have to update slides. So this actually, we'll have to update this photo because as of last November, we've actually had a changing of some of the members of the Democratic Congressional Black Caucus here in Colorado. So we actually have 9 members representing both houses in the state here, 3 state senators and 6 state representatives. When it comes to that, we're very happy that we have even more representation than we've had in the past in the state of Colorado for Black and African American communities. There's still not enough to be able to address with some of the system level impact around how we actually deal with healthcare and what we receive as far as care. When it comes to health advocacy organizations, rarely are they diverse enough or focused enough on equity that helps create a lot of these community level changes for us. And when it comes to healthcare policy, a lot of them are not very conscious around the racial implications of the policy, and representation helps with that, but there's still a deeper need to make sure that we actually have a greater impact in that space. Our representatives can't do it by themselves, so we want to make sure community members are able to work with them to be able to create this change. So what is community-driven healthcare policy, health equity? Well, with this in particular, it's an opportunity for us to make sure that, and I'll talk a little bit more about how the program works. It's an opportunity for us, again, to uplift the voices of Black communities here to the level in which it grabs the attention and influence of policymakers and decision makers, again, from community all the way to the Golden Dome. The way it's done is by using data, data that we've had access to for long times within academic literature, within healthcare systems themselves, and data also in the form of stories that are told by community members themselves and community leaders and entities that serve community. And the way this program is set up is to make sure that we can bring everybody together that has an interest of serving this community and are part of the community, and working together to actually make sure that we're able to impact the outcomes of these healthcare systems. And one way, again, to do that is by using that data, using those stories to actually engage with policymakers and decision makers across Colorado on the different ideas and solutions that community says will actually help provide health equity changes for them, and something that we can actually measure and is something sustainable past the project's length of time. One thing I will mention is that this project is it's funded by a national foundation called the Robert Wood Johnson Foundation. It's a 2.5-year project, and we began at the beginning of last year. Unfortunately, at the height of at the beginning of the COVID pandemic, it did change a lot of the ways that we interact with community. We had to switch a lot to more online engagement to make sure that we can let people know about this opportunity to have an influence on what they need as far as health issues being addressed, and some of the stories they want to share around these experiences. So one of our overarching goals is to make sure that community leaders are driving this policy change. And ultimately, it's to help improve health equity for these communities. We'll mention that when we think about community leaders, it's not more of traditional leaders when you think about people running nonprofits or running faith organizations. It's also community members. It's looking at people that are able to actually say that they live within the community, they experience the life that they actually are being impacted by when it comes to these policies, and they're able to actually speak and be uplifted and supported in ways that will make sure that they can actually have this influence. So we'll talk a little bit more about how that works specifically with BeHeard. So the BeHeard project in particular, some of the goals and strategies we have. So there's 4 key ones. Initially, it's going to be, again, the build public will within these communities for public health change. Back in June and July of last year, we put out a survey called the Health Priorities Poll. And we wanted to figure out, when it came to these communities, what exactly is it that they wanted to have addressed? What were some of the big key issues for them? And more specifically, what was the priorities for them on getting those to be something that would change for the better at a community-wide level? So that was our first way of kind of gauging around, you know, what are some of the issues that folks are interested in, and also to introduce them to the BeHeard project. Second is to make sure that the project is moving into the space of building political power, and to be able to use the influence of these communities and their stories to be able to actually impact healthcare policy. The way that's done is by actually developing grassroots leaders to focus on making that change. When we talk about grassroots, we are again talking about the community level. Grass tops are thinking more about the larger health systems, foundations, nonprofits, business entities that can often not be diverse enough or not have enough of a health equity lens to actually serve these communities. So this is something that we want to do from the ground up, and making sure that communities put to the front of this and they're leading the work. And ultimately what that will do is create a model that's led by community that will help impact these changes. And the way that the BeHeard project is by making sure that we're working with community and other partners that want to serve that community to co-design an advocacy leadership program. And with that, we'll talk a little about details, but really that's supporting the ideas, the issues, the stories of community members, using actual tools, using training, using opportunities to connect with policymakers and decision makers so that they can get their stories out to the front and help lead that work. Here we have just a cycle guide to kind of show you how this works. So at the top right, we'll start right after the blue arrow at survey and the health priorities poll that we use on community issues. So we use that at first to, again, gauge what were some of the issues that community was talking about. And we're moving down into the second part right here on the right side after the yellow arrow, which is to design a leadership program to support the communities, support community members on becoming health policy leaders. And we want to make sure that we're actually being able to offer a leadership program that's supported by our 2 organizations and other community partners and entities that are designed by community members. And it's not something that is being given to community members that we think will work for them. It's something that community members have told us in the design process does work for them. And moving into the next one, we have it where we're creating around the leadership community group is a coalition or a working group to develop policy agendas and actions. And again, this is something that community members are taking into their own hands and being supported by us so that they can actually create things that will lead us to the very last step, which is to engage in the policy process with decision makers to help create the equity on the issues that they define they want done. So when we go into the research piece of this, this is one that we like to make sure that, again, with research and evaluation methods on community levels, you want to make sure that everybody's involved from the very beginning to the end of the process. So the design process starts with this, and it starts with the community members. So with this, we want to make sure that this process of understanding what are the key questions or issues that community wants, helping support them by using actual research that is already existing through academic literature, things that other states are working on, and also ones that we conduct ourselves through methods such as surveys and polls, focus groups. And we're going back to the group and using that to share the research and to look at that data and understand what is it that we're learning from it and how can we actually turn that data into actionable policy agendas and tactics so that we can engage in the policy space. And again, this cycle is supposed to be in service of the program's partners and also the community leaders that are in the program to help achieve the goals that the community members would like to have defined. With this, we want to make sure that we have timely and relevant data and information. And this might look like something along the lines of healthcare outcomes or disparities data and things that really inform of what's actually happening at larger system levels that community members might not be aware about that would help inform their messaging and their communications and influence in the policy space. And using that ultimately, again, to increase the knowledge and being able to inform on the tactics and solutions that community members want to offer, and using all of that to translate it into a strategy that's actionable and sustainable. This grant is funded for a period of time, but we want to ultimately leave a legacy behind that community members can take complete ownership of and be able to continue using to build different equity efforts across the state of Colorado. And just want to make sure I'm good on time here. So the way that this is all backed is behind is a simple method of just making sure that the difference is made by making sure that community is centered completely in this work. Just simply to say that all of us have our own voice when it comes to our lived experience, when it comes to our ideas of what issues need to be addressed and the solutions that need to be made to address those solutions. Every individual has a voice around that issue. And we want to make sure that everybody's voice is uplifted. So when it comes to community members, this is set up in a way where they're completely engaged in a way that allows them to share power and have a common shared voice around what they would like to have seen done. And the way we build that is by using data and using different engagement strategies to be able to help them form stories that help them really solidify to them that this is really something that can be done and can be pursued with community power back behind it, and that it's something that can be used to actually help change the mind and the decisions of policymakers. These solutions are rooted in the understanding of the community and the culture. There's many communities and efforts across the United States and across the world that work on community-specific efforts, but there is no one-size-fits-all when it comes to these, it comes to solving a lot of these problems. So this is a process that will take time to make sure that it's very tailored to specifically the Black and African American communities in Colorado. And it's not something that is going to be something inauthentic to them. It's something that they can have every step of the decision-making process in their hands, and that we are there truly to support. And with that, with the voice, the stories, and the solutions being offered, we take those into action to create the change that the community defines as needs, and ones that ultimately will improve health equity here in the state. So as I mentioned before, with that, we have done that initial survey poll to kind of understand what are just some of those healthcare issues and priorities. But we are at that stage now where we are still recruiting for the leadership curriculum design team. And with the design team, there's really 4 parts to that. With that, we have collaborate, design, recruit, and learn. So with collaborating, it's with, again, community leaders, and that means community members themselves, not just people from organizations, but making sure that we are bringing those 2 together to help design a curriculum that is actually going to be useful and is going to be centered around the community. And using that to raise the awareness of the issues that community is bringing up, and then using that to also create actions and different strategies that can be deployed in the policy space. We are recruiting community member leaders right now to join in on this. I'll give some more details in the next slide around where we at in that process and what are some of the benefits of being part of the design team. But we would like everybody to consider the opportunity to be able to lead on the things that they want, while making sure, while knowing that this is completely centered around what they would like to see done. And again, this whole process allows us to create the leadership curriculum, but ultimately it's for us to continuously learn about what it is that community wants and what are some of the solutions that we could take together to be able to create that change. So some details around the design team here. So it is a facilitated design process, and it will be supported by both the Center for African American Health and the Colorado Consumer Health Initiative, as well as a variety of other community partners and leaders, experts from different backgrounds that are working on a variety of different health issues. The design team is there to really make sure that the curriculum is set up in a way where community can feel as though they have ownership and that they actually are guiding the work. But we want to make sure that with the design team itself, it's centered around community. And that's why we want community members who are interested in creating change for themselves and for others that represent them to be part of this process. Right now, again, facilitated, we also have, as an update, we have actually hired a community facilitator that's going to be working with the design team and the leadership cohort once the leadership program is created and folks are enrolled into that. And that person is going to help guide them through the process to make sure that all of our goals are being met when it comes to making sure community is being heard and that their issues are being put at the forefront. And they're going to be helping with making sure that they're supported by the research team on the BeHeard Colorado team here. Something as far as the time expectation. So the time commitment for this, ideally it's going to be between 6 to 8 meetings, and those will run about 2 hours each. As of right now, and sorry, I'll make some updates to the slide here. As of right now, there is flexibility around how often people are meeting. And that's something that the design team is also going to help with coming together and settling on something there. Because all of our meetings will be done virtually due to the COVID pandemic, we understand we have some more flexibility when it comes to meeting, but we also want to be very considerate that if we want community to be involved, that it has to be in the context in which community can be most engaged. So we want to make sure that they're able to actually help define how often, but this will allow us to make sure that, you know, we can still get the work done and there's some framework to it, but there's flexibility for community to be involved in it. You can disregard this. We originally created this slide when we were ahead of the holiday season last year, so behind the holiday season last year. So we are actually currently in recruitment. Ideally, we would like to see, you know, there's a range, but even 10 people on the design team would be an amazing amount of folks to be able to craft this work. And we currently have 4 people who are ready to go. And we want to continue encouraging folks to actually be part of this process. And we'll give you some information about how you can connect if you're interested in learning more about it. And also, if you want to just go ahead and let us know that you be part of it, we can make sure that you're connected with communications going forward. And then finally, there's this piece around stipends. So when you participate, we are giving out stipends to everybody who's participate in the design process. So we understand that you know, everybody donates their time, treasure, and talent in some way, and we want to be able to compensate you not only in the benefits of being part of something that helps transform how communities' health and well-being is being crafted through policy, but also through being able to give you a financial incentive. And there's a wealth of different connections and networking opportunities for folks when it comes to working on the issues they want to identify or important to them. If that might be something around prescription affordability, if it's around access to healthcare, if it's around community-based health programming, anything that pertains to health and well-being. We want to make sure that we're hearing about that so that we can understand where are some of those policy levers in which we can influence and make sure that you guys are be able to actually help have the positive impact you would like. And we're at the point now, sorry, we actually have 5 minutes for questions. What I would like to do is, you know, we're going to go ahead and look and see if there's any questions here in the chat. My co-partners here have been gracious enough to actually put a lot of contact information and web links here regarding the program. So I want to encourage everybody to take a look. If you have any questions, feel free to put in the chat here. Excuse me. Oh, and sorry. And oh, sorry, lost my voice now. Oh. Apologize. If you are interested, here's some contact information. If you want to learn about the BeHeard panel itself, you can contact me on my email there. And if you're interested in joining the design team, you can contact Adam Fox, and his email is posted here as well. And if there's any questions, and also thank you, Adam. You guys are actually putting it in the chat as well. But if there's any questions, feel free to put in the chat. We do have a few more moments before the end of the session here. And feel free, Adam, Adela. I know Chris is also here. He's the second half of the community engagement research team. If you guys have anything you want to add, feel free. But we'll just continue looking for questions here on anybody who might be interested in the program or also the design team itself. And just checking, I don't see any questions as of right now. If there is any, feel free to throw them in there. And everybody, thank you in the chat for the kudos. I apologize, my voice gave out there at the end there. Yes, and I want to point out also with Adela, that facilitator that I mentioned that would be working with the design team and the leadership curriculum themselves. That is actually Denver's own Jeff Campbell, who runs the Emancipation Theater Company. They do great work when it comes to storytelling on specific issues around race and different social impacts. So we are very excited to have him be able to lead that, because he's ideally the person who's going to be able to actually talk to community and be able to translate and inform some great ways of being able to take those stories and help create some change in the policy space. All right, and we also just want to note that there is a link here for the design team flyer that will take you to the Colorado Consumer Health Initiative's webpage. Feel free, you can click on that. It'll open up a PDF for you and give you some details around that. And just make sure I'm not missing anybody here. And just looking, you guys had some great magic wands as well. That's something I noticed, is that there's no one solution that folks think of. There's a variety of different things within healthcare that we all identify as issues, and very glad that you guys could all, give feedback on that. And Chris, thank you. Will everybody get that cool shirt if they're part of the design team? I don't know. We're gonna have to check the budget. We might be able to fit that in. Thank you. Yes. All right, that is perfect. Well, I don't see any questions. It is, we're just 1 minute away from the session close. So I do want to say thank you to everybody who was able to attend our session here. I do want to say, just as a note, that if you enjoyed the session in the Hoover web browser, there's a button in the session you can click that says like session. If you're using the mobile app, you can actually do a 3-star rating. So feel free to give us, let us know how you feel about this session. And to that note, we'll actually close out and feel free. There's actually one session right now that's still running around COVID resiliency. They're about halfway through. They end at 4. Feel free, if you want, you can jump in and join that. But until then, at 4 o'clock, we'll be doing the official summit closing. So we'll meet you guys back then. And thank you all again. We'll see you at 4 o'clock.